Live on Facebook, and yeah, you can go ahead. Go ahead, Dr. Preety. All yours.
All right. Do you want me to go ahead
Yeah,
or?
yeah, yeah. Go ahead.
All right. So, hello everybody. How are you doing? Good morning, good afternoon, good evening, good night to all of you in all parts of the world. Um, it's showing me that it's going to go live in the next couple of seconds. So I don't know if I'm going
On
to
live.
once again go ahead and check what I'm going to once again say hello to everybody and once again the greetings of good morning, afternoon, good evening, good night to all of you.
Good night.
I'm Dr. Preety Shah
I'm
and
Dr. Prajakta.
welcome today for this little talk on what makes homeopathy so special. And thank you so much, Kartik, Uta, and Genova for organizing all of this. And thank you for all your hard work and behind the scenes work for us. Yeah. So today, Prajakta and I want to share with you what makes homeopathy special. Okay, and our talk is going to be more relevant to people who are new to homeopathy, who would want to learn more about homeopathy, and also to budding homeopaths. If you're new to homeopathy and you're finding different ways of how to work with homeopathy and practice, I think this is also going to be very relevant to all of you. Okay, so both of us, Prajakta and I, have been practicing together. We have a couple of holistic centers here in Mumbai, and we see patients globally. And along with homeopathy, we use a lot of other holistic therapeutic modalities to heal our patients. And we've been in practice for the last, 12, 13 years. And over the years, we've realized that for different people, homeopathy is special for different reasons. Yeah, homeopathy can be very rapidly healing all your chronic complaints. You've been suffering with rheumatoid arthritis for years and years, and when you start homeopathy, you can see that your results, your symptoms get so much better. It's very gentle. There are absolutely no side effects. A child of 1 day old to geriatric population, psychiatric patients, pregnant women, everybody can take homeopathy. It's so gentle and there are absolutely no side effects. So I think that is also very special about homeopathy. Also, it is not a symptomatic treatment. Yeah, so you're not coming here to a homeopath and just getting a pain relief. So you're not just coming for a migraine and taking a painkiller to get your pain relief. Or you're not just taking a pill to keep your blood pressure under control. What you're coming to a homeopath and to its healing modality is a more permanent solution. You go to the root cause of your complaints and then heal from within. So it is not a symptomatic treatment, it is more holistic, it's more thorough, it's more 360 degrees. And that also is very special and very different about homeopathy. Also, what is special about homeopathy is the case taking bit of it. Yeah, how does a homeopath approach your complaints? And that is so unique, so special, and so different from all the other therapeutic modalities that are available. The conventional medicine, which is the allopathic medicine, you have many other natural medicines. You have naturopathy, we have Ayurveda, you have so many other methods. But the case taking, how does a homeopath elicit the symptoms? How does he go about understanding you as a person is so unique and so special that today's talk we would like to focus on this bit of homeopathy. And how is this case taking different? It's different because the homeopath takes a lot of detailed understanding. He will understand about your symptoms, when it started, about your all your physical complaints if you come for a physical complaint to a homeopath, but also about your nature, also about your past history, also about your emotions, about your dreams, your hobbies, and all of that. And why does a homeopath do that? He or she does that because the premise or the base or the main pillar of homeopathy is that it is an individualistic therapy. That means it is not important for a homeopath to know that you have a diabetes, you have hypertension, you have this sort of cancer. We don't super specialize in diagnosis or putting a label to your symptoms, because for a homeopath, a disease is more than just a symptom. Hi Karthik, can you hear us? All right, I think there's a technical glitch, and I really hope we were not talking on mute all this while.
No, I don't think so.
So we're going to wait for Karthik to come back and see if we are still live and if it's all
Shows
still
streaming
working.
live. It shows streaming.
All right, we lost Karthik, so let's figure this out. Okay, hi Karthik, you're back. I don't know what happened. You're on mute. You can hear us. Maybe a thumbs up will help. Okay, perfect. So yeah, what was I
So we were
saying?
talking about this, the Alex Carroll.
Yeah,
Who has
Dr.
been
Alexis Carroll. Basically, what he says is that a disease is a personal event. It consists of the individual himself, and there are as many different diseases as there are different patients. So if Prajakta, for example, has a hormonal complaint, she comes to me for I don't know, ovarian cyst, and I also have ovarian cyst. We are not going to be taking the same hormonal pill, yeah, because we as individuals are different. And what a homeopath focuses on is find this individualistic, this peculiar, this unique characteristic of the individual who is suffering, and not the label of the disease. Yeah. So this is how homeopathy and the homeopathic case taking is different than a regular, conventional medicine. Okay. Also, what is important is that it is not just eliciting symptoms, like you're not a data collector. A homeopath is not just sitting there and collecting, okay, what is your chief complaint, since how many years, what is your family history, do you have any allergies, what is your fear. It's not just collecting it mathematically or mechanically. It's a very artistic method. How the case taking begins from the moment the patient enters the clinic, the way the patient books an appointment, the way he talks to your receptionist, the way he enters your chamber, and the way he's sitting, talking, his hand gesture, the clothes he's wearing. So it's a very artistic, very intuitive, and a very scientific process. Yeah, it's not just mere collection of data. It's not a data collection. Also, for a lot of people who are sensitive, who are evolved, and who can understand this, the case taking process itself can be very therapeutic, because it can lead you into a journey of self discovery, a self inquiry, and you can understand so many things about yourself through this case taking modality. Yeah. So before even you take the homeopathic remedy, half the job is done, half the battle is won with the case taking. Yeah. So this understanding of you as a person and matching it with a similar homeopathic remedy which is found in nature, this really helps you at such deeper levels. If not just your physical complaints, your emotions, your feelings, your experiences, and it has such a universal global effect in your well-being that it's miraculous. Yeah. So to understand this little further, maybe I don't know, Prajakta, you want to add a few
Yeah.
thoughts?
So when we're talking about this case taking and the details of it, so we start with the normal activity, the name and the age and those medical histories which the patient has it in the past, or any operation, surgeries, or any major illnesses that he had in the past. We take the consideration of that. Along with that, the family history, because there are certain diseases which we understand, like diabetes is a genetic, so we understand the family history, and there is any particular complaints the parents has. Also about the chief complaint, like why the patient is come up, for what complaint he's come up with, right? And qualifying those complaints also, along with the chief complaint, if it is so if there is a pain in the head, but what is the quality of that pain, when it gets more aggravated, when it is less, what apart from the medicine, what are the things that make him feel better, or are there any other complaints with it, like you have say dryness of the eye along with your headache, or just the blackness in front of the eyes before the pain starts. So all these details also,
That
we
qualifies.
yes, that also we take into consideration. Then physical generals also give us the complete picture of an individual, like how is his appetite, what are his likes, dislikes. Intense craving is also very important, because it's a very peculiar and it's very subjective to that patient. And then how is his thirst, how much is he thirsty, what, how much is he thirsty to drink, and along with that, how is his sleep,
Hello, I think we just lost them. They're coming back. Yeah, I can hear you. Can you hear me? Your mic is muted. Okay, you're on there. Go on.
So the case. This is my doctor, and she's saying goes for or few more physical healing this way. As if
Doctor, can you just refresh your browser?
okay,
This normally happens when there's a very weak internet connection or the internet drops. The voice starts to break. So we just wait for them to join back. Midst of a lovely presentation. They have entered the room, but they haven't. I mean, we still can't see them. They should be with us in a minute. Still not, still not got a good internet connection. Uh, you hear me, doctor? This is got a real bad connection. They haven't yet been able to log on. No idea why they have this problem. Yeah, I can hear. Oh, they're back. Your voice is still breaking, doctor. Well, they do have a bad internet connection, and looks like they're just being disconnected. Hello. Yes. Voice. Your voice is still breaking. There you are. Hi there. I just wanted to check. Are you on a Wi-Fi or are you directly connected to the cable? Uh, let's see if they still don't have a good internet connection. Maybe we can reschedule their talk and we can have Dr. Elizabeth Turos with us. Ali, are you there with us, Elizabeth? Oh, hi there, Elizabeth. How are you doing?
Hello, thank you. I'm well.
So, yeah, so I think you have a good internet connection. Maybe we'll request Dr. Prajakta to, have their session on another day, or maybe even after you finish, so
Okay.
we can continue. All right, so I'll just get this off and I'll get your presentation on. maybe they'll join us. There you go, Dr. Elliot.
Okay,
That
so
all
should I
yours.
start?
Yes, please, all yours.
Okay, thank you. And the PowerPoint, is it, do you see on the screen? Okay. So, namaste and hello everyone. Uh, I am Dr. Erzsébet Turos, homeopath from Cluj, Romania. And I would like, first of all, to thank to Genoveva and Uta for this possibility to be part of this great event. And because for me, it is the first time when I participate as a present on a webinar, let me say a few things about myself. I cannot move the slide. Hello, okay. So, I'm a medical doctor and homeopath from Romania, and I practice in homeopathy since 7 years. But before to become a homeopath, um, I studied and did many other things. For example, I have been trained in family therapy. I have a master's degree in psychological counseling and psychotherapy. And maybe the most important thing is that I worked more than 20 years in psychiatry. In this way, I had the possibility to increase my observation skill working with mental ill patients. Um, There in that hospital, my work was kind of innovating work. I introduced occupational therapy and art therapy in recovering of mental ill patients, and the highest recognition of my activity was in 2005 when I was nominated for Nobel Peace Prize, along with other 999 women from worldwide. About my um, studies in homeopathy. So after I finished my training in Bucharest, I followed the e-learning course with Professor Vitulkas, from where I gave my diploma in 2016. And in the same year, I met for the first time Dr. Shankaran and the sensation method, which had a huge impact on me. So after 2016, I followed many online courses about repertorization and mentoring at the Other Song Academy. And in 2018 and in this year, I had the chance to visit the Other Song Academy. The story about my work you can find in this huge book, and about my motivation to introduce the art therapy in to introduce the art therapy in the treatment of the patient, I would quote what Benjamin Disraeli has written, that the greatest gift you can give to a person is not from share from your riches, but to reveal to him his own. And I think that this I am doing also now through homeopathy, because we know that as homeopaths, our case taking already start uh, the healing process in the patient, giving them very deep insights most of the time. Um, and because I cannot move the slide.
I'll do that for you.
Okay, thank you. And because I am also a passionate homeopath now, uh, I have spoken about homeopathy many times in television, in radio, at different workshops and conferences, uh, trying in this way to bring awareness about the potential of homeopathy. But now, the next slide, please. Now, coming back to my topic from today. Today, I will present you um, a case about a girl who was the victim of bullying. This is maybe not so common as a topic, but through my case, I would like to illustrate that homeopathy can be very useful even in this problem. So, what does it mean, bullying? Bullying is an aggressive behavior characterized by hostile intent The harm is deliberate, not accidental. There is an imbalance of power, a real or a perceived power inequity between the bully and the victim, and it has to be a repetition over a period of time. And there are also two additional criteria: the victim distress on psychological, social, or physical trauma, and provocation. And about the effects on victim of bullying, there are short-term effects, which are depression, anxiety, anger, helplessness, a significant drop in school performance, or even attempt to suicide. And there can be also long-term effects, like the person will feel insecure, will have lack of trust, extreme sensitivity, they became hypervigilant, they could present an avoidant personality disorder or even post-traumatic stress disorder and other health issues. And about the importance of the phenomenon, the next slide, please. About the importance of the phenomenon in according to a report of the World Health Organization, the bullying in Romania, the school bullying places Romania in third place in Europe. So that is why I consider that we cannot ignore this problem. And about the homeopathic approach, for people who are not homeopath, I would like to remind that homeopathy has some basic principles, and maybe the most important two principles which homeopathy is based on are the individualization, which means that we treat the person, not the disease, and the other is the holist, which means that when we select a remedy, this is based on the totality of the symptoms on mental, emotional, and physical level, taking in consideration also the causality and the life circumstances. So, from the homeopathic perspective, I would put a question: what makes a person a victim? And I think that the best answer we can find in Dr. Rajan Shankaran's book, The Other Song, Discovering Your Parallel Self, where he had written, at some point we realize that stress does not come from outside us, but from the way we perceive reality and react to it. And this is unique to each of us. Most of us realize that in the end, it doesn't help us to change external circumstances at all, but we have to understand what stress generates. This sensation is our constant companion. It is the other song that is always heard inside us. So, I think this is the best answer on my question. And this case, which I will present you in the next, reflect how true are what Dr. Shankaran has written. So the case, it's a 15 years old girl who perceived herself as a victim of school bullying. The first consultation took place at the end of November last year. She came with three psychiatric diagnoses: performance anxiety, panic attacks, and obsessive compulsive disease. But her case history started 4 years back because at the age of 11, she was already consulted by psychiatrists and neurologists because she was all the time exhausted, restless. She presented trembling and excessive worrying about her school performance. So at the age of 12, she already was diagnosed with performance anxiety and she was treated with sertraline. A years later, at the age of 13, she got also the diagnosis of obsessive compulsive disease and she was treated with Feverin for 8 months, but again, without any result. And since 1 year, she followed also individual psychotherapy, but her evolution was stationary. So, about her chief complaints. She is suffering from bullying in her school since many years, but the phenomenon became so seriously that 3 months before, her parents sold their house and moved in another city just to take distance from the old schoolmates. So she started the 9th class in the new city with new classmates. But 2 months after she started the school in the new city, she started feeling again that she is bullied. She also has an obsessive compulsive behavior, washing her hands frequently and turning off the light repeatedly. And she has a constant high level of anxiety. Now, we see that in homeopathy and also in psychiatry, it is very important, the observations. So my observations at the first consultation were as follows. The patient came together with her mother. There is a thin young girl, very timid, avoiding eye contact. The mother started to tell the complaints, but she interrupted her and continued her story. She has a very specific loquacity, a hasty way of speaking, without eye contact, asking many questions, and she was crying all along the consultation. When I asked her about her nature, about her perception of the problem, the next slide, please. Then she said that she's a very anxious person, worrying a lot, a kind of perfectionist, used to learn a lot being the first in her class. But she feels attacked by her classmates. They consider that she is the teacher's favorite. There is a girl who is always superior to her. She feels hated by her. She was suffering a lot. There were one girl who was her friend, but the other girls stole that single friend of her. Also, other classmates behave very badly with her. And everyone gossiping about everyone. So in every day, she used to go home crying. So she feels excluded all the time. She is disappointed, always despised by others. She felt exploited by others regarding her homeworks. She has no courage to turn against them because the other girl manipulated the whole class. She was never self-confident. She felt always looked down upon by others. She was accused that she arranged her marks, which she has never done. Even her best friend didn't support her. She had no good relationship with anyone in her class, and her mood is very changeable. About her fears, she has many fears. She has fear of being rejected. She has fear of being alone. And if she has to remain alone, that she feels very, very lonely. She has also fear of diseases and of bacteria. That is why she used to wash her friends' hands frequently. She has fear of future, fear that cannot make friends in this new school either, fear that she will be disliked even in this new school, and that she cannot fit in this class also. Fear that she destroys everybody's life, especially her family's life. And she used to feel hopeless, cannot see the sense of her life. And she has also fear that she cannot control her thoughts. And she is full of negative thoughts. She used to think that she is ugly, disgusting, irritating, and she also feels irritated by others. She is also full of guilt and sadness because of moving her family in the new city. She cannot manage properly the time, spending too much time checking her phone. She feels jealous on others who are more popular than she is, and she used to be impatient if her family doesn't give her attention. She cannot hurry, not in the morning, neither with homeworks. She is always late. She likes being consolated, would need the company of others. She cannot open up, cannot be herself, and used to anger easily on slightest things. So, the next slide, please. When I asked her which is her biggest stress in her life and which are her interests, she said that the biggest stress was when she felt excluded from the class and the relocation of her family. She is weeping a lot at home, but not in the class, not to be perceived as a weak person. She likes to read, to swim, the feeling of happiness after exams, but before exams she has panic attacks. She liked very much her dog in their old house. For her, the dog was like a family member. About her relationship with her family members, she said that the mother is her best friend, but there was also an ambivalence because the mother is one who encountered her anger also. With father, she has no good relationship, and with her sister, she used to have a lot of fight. About her dreams and sleep, she used to have dreams about animals, dogs and cats, dreams about traveling, accidents, dreams about exams, losing her teeth. She used to go to sleep late, midnight after, and sometimes she is sleepless because of constant worrying. Her sleep position is on abdomen. The next, please. About her physical generals, she has her nose are obstructed, alternative side. She is sensitive on odors and noise. She has headache on stress situation. Her appetite is increased. She used to be hungry constantly. She also has desire for sweets, meat, and onion. She is thirstless, constipated, chilly, and has menses irregularity. So now, when I analyzed her case, the next slide, please. From the system point of view, we can see that there are the following themes which appear. This victim aggressor theme is everywhere. She versus others. The others can be her classmates, her sister. There is also this theme of hierarchy. The other girl is superior. She is inferior, despised, rejected, excluded. There is also the theme of persecution, everybody gossiping everybody, and the constant conflict, being accused that she arranged her marks. There is also the theme of attractiveness, but she considers herself ugly and irritating. And the competitiveness, that she is jealous and who are more popular than she is. And she also has this need to belong to the group, the need of the company of others. Alone being feels lonely. Others' opinion is important for her, and she also feels guilt for her family. So from these themes, it's obvious that the remedy should belong to animal kingdom and to mammal group. And now if I analyze the case from the symptoms point of view, and I repertorize her mind symptoms, taking just a few symptoms like ailments from anticipation, desire for company, alone aggravate, delusion despise this, delusion insulted this, delusion look down she is, fear of alone being, fear of contagion, the jealousy, changeable mood. And it is very interesting that I find this single remedy rubric, which I think that is the genius of her case, fear of separation from friends. And the remedy which cover all these symptoms is leccaninum. It is very interesting, this rubric, because this reflects exactly how she felt, because although she felt not accepted by her classmates, she still has had this desire, and the biggest fear of her was this from separation from friends. And now if I repertorized her physical symptoms, these are very typical also for leccaninum, like nose obstruction, alternative site, her increased appetite, the menses irregularities, and also the dreams are very typical for this remedy. And now if we read the Materia Medica of leccaninum, I find that the best description of this is given by Dr. Rajan Shankaran in The Soul of Remedies, where he had written, the main theme of leccaninum is dominance, and who is going to be on top. They develop a feel of low self-worth. I am not good enough. I feel dirty and horrible and become contemptuous of themselves. This dirty feeling is also common to animal remedies, and it is similar to the feeling of ambra grisea. Leccaninum patients suffer by comparison with others. They try hard to please, to be liked, cared for, and accepted because they feel left out and rejected. And this was exactly her main feeling. They can develop malice and consider that somebody else is responsible for their condition. She feels she is uncared for and neglected because her body looks bad. She starts feeling dirty and washes herself frequently. This is exact what about her obsessive compulsive disease one. And now if we read from the Mangialavori's edition about leccaninum, I choose a few rubrics from there, what Mangialavori is given, like contradiction of will, or undertakes things opposed to his intention. It is interesting because this rubric, we know that this is a typical rubric for sepia, but Mangialavori has given also leccaninum for this rubric. There is also the forsaken feeling, her anxiety about family, and also these dreams about animals and the dreams about losing teeth. Mangialavori is given leccaninum. And from the Roberts remedies, I find out that this single sentence described very exactly her sensation, that she is of no account, is looked down on by everyone, and is insulted thereby. Okay, and now, so I gave her the lecaninum 1M, which we know that belong to the psychotic miasm. And on the follow-up, which happened in January, please the next slide. After 6 weeks after the remedy, she was feeling better, was not so sad, no weeping. She is no more so irritated. She started feeling being appreciated. She said, "It is not good that I want to please others." Now it does not bother her if others are seeing her bad parts also. So she said, "There is in me not to give up." Her compulsion to wash her hands and turning off the light reduced. Her nose is no more obstructed and had neither headache. Her menses started 3 days after the remedy. Important to notice that earlier months she had no menses. But because because her suffering was very long, please the next slide. There were some symptoms which remain, and some other new symptoms came up after the remedy. So she has fear from people. She's constantly preoccupied. Are the others loving me or hating me? She's feeling excluded even now and looked down upon. She has this sensation that she failed to fit in. She said that I am not belong to them. And she said that I can be natural, can be myself. And there was also another very, very peculiar symptom that she feels irritated when others are laughing around her. And these symptoms I find very, very peculiar. And it was also very intense because she repeated many times how irritated she feels when others are laughing around her. And there was also another very peculiar symptom that she cannot go to the toilet at school, so she holds back until she gets home. Interestingly, she was conscious about her loquacity, but she said that she cannot stay silently. It makes her tense, so she speaks too much, compulsory, just to avoid silence. And now she is missing their old house and their dog. And she used to be sleepless from worrying when she going to sleep. So I reevaluate her case and I repertorized again her symptoms, taking in consideration especially her very peculiar and intense symptoms. And I find out that there is a single remedy rubric that disgust at laughing of others is a typical rubric only for Ambra grisea. But only the other rubrics are very typical for Ambra, like loquacity, asking questions one after another, or the love for animals also is typical for Ambra, the embarrassment, the fear of people and fear from the opinion of others. And I remember that at the first consultation, she said that she likes to swim. So when I put swimming desire, there are also 3 remedies. And between these 3 remedies, one of them is Ambra grisea. So now she needed Ambra grisea. So I gave her Ambra grisea. She continued the treatment and first, if we read the Materia Medica of the Ambra grisea from the same book from Rajan Shankaran, he had written, Ambra feels a tremendous sense of embarrassment. This embarrassment is more when it comes to personal habits like passing stool and urine. This feeling of embarrassment creates tremendous shyness in company and in the presence of strangers. Young girls with this Ambra feeling has this very specific loquacity. And from the Morrison's desktop guide, we can read about Ambra that ask question but does not wait for the answer before saying something else, silly loquacity, aversion to company, especially strangers, great shyness, intolerant of company when defecating, and great sensitivity to noise. So these were exactly her symptoms. So now I gave her Ambra grisea, 1 dose at the end of January, and she repeated again 1 time at the end of March. And the following slide, please. And okay, and the next. And on the follow-up after 6 months, I find out that she is feeling much better, weeping no more after school. She is more brave and she is more open. And in conclusion, I would like to say that homeopathy can help very effectively the victim of bullying through strengthen and healing them from within. And I think that would be worth to take into consideration the homeopathic therapy for most of the victims of bullying, especially that the victims of school bullying are children. And it would be very important to treat them homeopathically and not with very strong uh, psychotropic medicines. And homeopathic can be combined with different psychotherapies also. And as the last conclusion, I would like to quote again what Dr. Rajan Shankaran has written in his other book, The Spirit of Homeopathy, that the disease is a delusion and awareness means healing. Disease is a limitation of vision, a narrow way of looking at things. Only the awareness of this illusion can remove it, just as light removes darkness. Meditation, philosophy, and psychoanalysis have to do largely with the awareness of the false perception of the present. Homeopathy is also based on this. So that is why homeopathy can be really helpful. So thank you for attention. Thank you for your time. And do not forget that the beauty we see in another soul is a reflection of our own. Thank you very much. And if you do have questions, you can write to me. Uh, the last slide, please, where I give you my email address. And you can contact me also on my Facebook page, Homeomedica Dr. Turos Erzsébet. Thank you very much.
Thank you, Dr. Elizabeth. It was a wonderful case of bullying. We don't see this case very often. We
Yes.
don't hear about this case very often, and we're honored to know that you were. Her name was given for the Peace Prize. Nobel Peace Prize was nominated.
Yes. Yes,
That
in
was excellent.
2005. Yes, yes, it was the
2005.
yes, it was very nice. I am very grateful for this. Yes. So
Wow.
thank you very much. And that is why I consider that it's good to know that homeopathy can help even in this kind of situations.
That's right. And I think it helps a lot in the mental situations. It's got a lot of
Yes, yes, yes.
activity in the mental. So thank you so
Yes.
much for this, Dr. Elizabeth, and we hope to see you more often and with the Get Well with Homeopathy channel, right?
Thank you very much
All
for the
right.
possibility.
Thank you so
Thank
much.
you. Bye.
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 And I hope you all enjoyed this, and we look forward to see you tomorrow at 7:30 Indian Standard Time or 3 o'clock GMT. So see you then. See you tomorrow. Bye bye.
Bye. Bye.